All right, today we're going to do administration of drugs with a lifespan, Chapter 8 and Chapter 12, pediatric dosage. Pediatric dosing should not be super hard. It's a lot similar to what you've been doing, but there are some new things that you have to learn that are not as hard, but still need to learn. All right, so by the end of this class, you'll be able to differentiate the physiological changes during pregnancy that may affect absorption, distribution, metabolism, and excretion of drugs, as well as lactation. Develops the nursing interventions that can maximize the pharmacotherapeutic outcomes in patients from infancy to adolescence. Synthesize knowledge from pediatric medication administration and safety during clinical nursing practice, and calculate safe dose ranges according to the patient's body weight per day and dose, and with the safe ranges are, if their safe ranges are appropriate. So, pharmacotherapy across the lifespan. So everyone's individual, as we've all known that healthcare should be individualized. It should be patient specific. Okay. Babies and children are not little adults. It does not work like that. They do not just work like little adults. Okay. There's lots of ways to approach how to get them to take medicines, how they take medicines, things like that. It's not going to be the same as dealing with an adult. All right. So pregnancy and lactation and how that can affect drug administration. A lot of times they'll stop most drug therapy while you're pregnant, except for serious conditions like infections. If the infection gets worse in your body, it's going to harm the fetus. So they want to take care of it. They just have to find a specific drug that's not going to harm your fetus, the fetus. Not just gestational diabetes, just normal type 1, type 2. You don't stop that either. Hypertension and gestational hypertension, and then epilepsy as well. The benefits have to outweigh the risks, especially with all these medications, if they're going to potentially harm the fetus. Okay. So the absorption of drugs is changed by hormonal changes in your body. Inhaled drugs are sometimes absorbed even faster. Your cardiac output, plasma volume, and blood flow change because they're supporting a whole nother human or multiple humans. So obviously the metabolism and the blood flow, the distribution of the medications are going to change because you have more plasma volume, you have a higher cardiac output, your heart's going to be beating differently and harder and with more volume. So that's definitely going to affect how the medication's distributed. And then your rate of excretion may increase because in the beginning, before the baby has kidneys, you're the baby's kidneys. So you have to filter out those toxins, especially minutely until the baby's kidneys are working themselves. So a teratogen, which you may know what this is, it's some kind of substance, organism, or agent that can harm the fetus, whether that's full-on death or just structural or functional changes, mental changes, things like that. The more teratogen, that you ingest, the higher the risks are. So when will they affect the baby the most or the fetus the most? Between weeks 1 and 2, teratogens either cause death or have no effect on the child. When you're 1 to 2 weeks pregnant, you don't even know you're pregnant. That's right after implantation. That means you have no clue. The embryonic period between 3 to 8, that's when most people figure out that they are pregnant. Oh, I've missed my period. Let me take a pregnancy test. And this is actually when the teratogens have the maximum impact on the fetus. So you found out you're pregnant, you stop taking the meds, hopefully. Between 9 and 40, we've talked about how blood flow increases. Medications can have prolonged durations of actions within the fetus. Okay, so the fetus is going to get whatever drugs you have, and it's going to have a prolonged duration of action. So we have to monitor that. Once again, measure the benefits and make sure they outweigh the risks. Okay, as you may know, there are several different types of categories for medications, especially in pregnancy, to see if they're safe. So category A means that studies have been performed on pregnant women and there's no risk shown. So A+, that's what we want. We want all the drugs you take while you're pregnant to be a category A because that's great. Category B is still acceptable, But the studies have been done on either done on animals and shown no risks, or they've been done on humans and shown no risks. That's basically what it is. So either the animals show no risks and there's no studies done on humans, or it was a risk to the animals, but it wasn't a risk to the humans, so that's still okay to take. Okay. So B is good, but not the best. C, that animal studies have shown a risk for the fetus, but no studies have been done on the pregnant women, or no studies on animals or studies on pregnant women, which means it may not be the most safe to take, okay? So it's a little iffy. We don't really want C's. D's shows a risk to the fetus. It's a known risk to the fetus, but these may still be acceptable but the benefits have to outweigh the risks. If the only medication that treats my epilepsy is a category D, I highly doubt they're going to change it because I need to not be epileptic during pregnancy. Okay. And then category X, we don't want. Not indicated, it's contraindicated. We do not give these medications to pregnant women. Okay. Studies have been done on animals or pregnant women. Fetal abnormalities have been shown, and it is absolutely contraindicated for anyone who is or may become pregnant. Okay, so how does drug administration affect lactation? So good thing is that there's few instances that can harm the infant. More likely, it's gonna be not helpful for the breastfeeding patient. A lot of medications can dry up breast secretions like peppermint, all the antihistamines I was told never to take. I can't take my Zyrtec that I normally take every day. And during allergy season, I died because I couldn't take anything because it dries up secretion, and breast milk is a secretion. So I couldn't take anything. Okay. My child could take all the Zyrtec she wanted, but I could not. Okay. So dangerous drugs usually have safer alternatives. The most important part is choosing the right drug. Okay. Not the right dose, not the right route, not the right anything else. It is choosing the right drug. Okay, so drugs with a high protein binding ability are less likely to enter the breast milk. Those are the drugs we want. Okay. So recommendations for using medications during lactation. If you're going to take a medication, take it after you've breastfed. The reason that is because just like a lot of people who drink alcohol while they're breastfeeding, which is okay, as long as it's within it's only one glass and you don't breastfeed within 2 hours of drinking the glass. It's okay to have alcohol. You just can't have a lot of it, okay? The reason you wait till after you've finished breastfeeding. So I've breastfed and I'm completely done, or I've pumped, I'm done breastfeeding for the next 2, 4, 6 hours, whatever it is, okay? If I take my medication right then, the breasts are empty, okay? So there's no milk in them. As the milk is being created, the medication's already being absorbed and metabolized by my body, okay? So my body is already trying to excrete the medication, okay? So the milk that is being made will not have the drug there because it's already being metabolized. If I take the medication while I still have a lot of milk in the breasts, then then all the medications are being metabolized through right now, and they will go into the breast milk. So that's why you wait till after, because if you have an empty breast, it will take time for them to refill. And the time it takes to refill, the drug is already metabolized. That is why a short half-life is preferred, so that it is already metabolized by the time you need to breastfeed again. Okay, the longer half-life should be avoided. Avoid alcohol, drugs, tobacco. You know this. Once again, select high protein bound drugs. Okay, avoid over-the-counter medications, dietary supplements, herbal supplements. And the last thing you have to ask is, does the infant have the ability to metabolize this drug? Well, children can metabolize ibuprofen after 6 months, that they can have ibuprofen. So if the mother or whoever's breastfeeding takes ibuprofen and then pumps or breastfeeds the child can metabolize it as well. So that's okay. Okay. If it's safe for both of you already, then if it crosses into the breast milk, that's all right. Okay. So infants, birth 12 months, safety of a child is primary, okay? If you're giving oral medications, you have to ensure that they ingest all of the medication. Because once they start spinning or spinning up, you don't know how much has been lost, okay? For toddlers and infants, there are lots of tips and tricks, and the more you do it, the more you'll learn from someone who's been there longer, things like that, of ways to get children to take medications, okay? And if you have children, then you know the struggles. One of the things that I've always been told is use a syringe, because if it's an infant or a toddler, they're gonna smack the cup out of your hand, okay? And plus they don't know how to drink from a cup. So we use a syringe or one of the droppers or whatever. And when you put it in, you put it in the back of the cheek, okay? And if they start to scream, you blow in their mouth, which sounds weird and kind of gross, but it works because it causes them to kind of take a deep breath, and then they instantly swallow, and then they've swallowed the medication and you're done. Works pretty well. They make these pacifiers now that have a hole in it, and you can screw the syringe into the back of the pacifier. So when you put the pacifier in the child's mouth and it seems like they're just taking another passy, and then you press the syringe and you give it through the pacifier, and so then they're getting their medications and they're constantly sucking and swallowing. Best thing they ever invented, okay? With the toddlers and the infants, the vastus lateralis is the only injection site available, okay? When you go get all your shots when you're 12 months old, 0 to 12, they use a vastus lateralis. They don't use anything else. Remember, the vastus lateralis is the lateral aspect of your upper thigh, okay? Of your thigh, sorry. Their deltoids are not, they're not big enough. They're not developed enough. Their ventrogluteal is too hard to get to, so they use the vastus lateralis, okay? So just know, if you're getting an IM injection, I don't care if it's an immunization, I don't care what it is, it's vastus lateralis, okay? Unless it's subacute, then it's different. But if it's IM, it is vastus lateralis, okay? When you are giving these kind of medications, the child should be held and cuddled either by the by the parent or by the nurse, okay? Whoever's there, if the parents aren't there, if the child doesn't have any parents, you hold and cuddle the child, okay? Whatever needs to be done, because they need that sense of comfort and that sense of everything's going to be okay to be okay, because they don't know how to self-regulate their emotions, okay? All right, so toddlers, so that's a period from 1 to 3. We want to teach them parents about proper drug storage. The toddlers and, small children should not have access to medication. They need to have those child lock lids on. They need to be in a tall cabinet, locked, hopefully. No medications need to be anywhere near the toddlers, not even multivitamins, okay? I can't tell you how many children accidentally got into their parents, especially blood pressure medicine, and then had to come to the ER for poison, and then we had to call poison control. And then, CPS has to get involved. Not that the parents, shoveled the pills down their kid's throat, but they had access to it. There was a possible, there were possible serious adverse reactions to these medications. So proper drug storage is super important. And then having the number to poison control is super important as well. You might as well memorize it if you work in the ER, okay? If you're going to give medications to a toddler, concise, very short explanations. Here's your medicine. It tastes like bubble gum. I'm going to give you your injection in your leg. That's it. I'm going to give you a shot in your leg. They can be comforted after. Oral drugs can be mixed with food, jam, chocolate, syrup. This is toddlers, because infants can't eat these kinds of things, okay? So toddlers can get their meds mixed in. Once again, vastus lateralis. Other sites, be aware. Preschool, 3 to 5. So once again, safe storage of medications. They can be now assist with giving themselves medications, as in here's your syringe, and they can push it in themselves. What are the things like that? Not drawing up how much it is. but helping administer it to themselves. Brief explanations, followed by administration. Once again, short, sweet, to the point. 6 to 12. Okay, now we've got children who are school-age children. They can make their own choices. Usually they might need a little help, okay? So give them choices if they're available, okay? If they have to get their medication mixed into food, ask them what food they want it mixed into. Let them pick out what ice cream they want, whatever they want. Let them encourage cooperation. Help them learn and help them understand stuff, okay? So now you can give them more detailed explanations. Hopefully the children are healthy between this time and you don't have to give them medications, but they still need immunizations and things like that. So between 13 to 16. Okay, so now we're in the teenagers' years. Teenagers need support. They need approval. They need to know you're there for them. 100% this privacy, asking, allowing time for questions, allowing them some sense of control is important. So making sure that they know you're there for them. Their parents are, just here. We can be as private as we need. You can make decisions for your own body now. We can talk about it. We can help figure out what solution we want to come to, okay? They're not going to take well to being told what to do, okay? So once again, tell them all the hazardous things: tobacco, substance abuse, peer pressure, sex, eating disorders, those things like that. But with medication administration, we need to provide important medication information. They are allowed to know what it is, why it is, what's it going to do to you, things like that, okay? And one thing we did not talk about with each category is how does this affect how I give my meds to my patient, besides the extra things like comfort, the sites, the explanations. It shouldn't change. The 6 rights, 7 parts of the order, the triple check, they're all the same, okay? We're not doing anything extra. So if we need to know if we need to go give our medication to a child, a pediatric patient, we're still going to ask them their name and check their ID band. And if you have an infant or a toddler who is or someone, period, that is developmentally delayed, it doesn't know their name, can't say their name, we're going to check their armband. We're going to do just like we would do for an adult who wasn't able to speak, okay? The most important thing is it doesn't change, okay? After about 1 or 2, they should be able to tell you their name, okay? Ask them what their name is and then go check their ID bin. All right, so now we're gonna get into math. So we have an order for clarithromycin, 15 milligrams per kilogram per day, divided into 2 equal doses, okay? But the main point is he's getting 15 milligrams per kilogram per day. They weigh 30 kilograms. How many milliliters will you administer? And this is the drug label below. I'm going to give you like 3 seconds. Pause the video if you need to, need extra time, and then we'll go over how to do it, okay? All right, so the dimensional analysis way, which is the way that I know the best, okay, is on top. So the question was asking for milliliters, so I always put what the question is asking for on top. So 5 milliliters. It's attached to this 125 milligrams because that is what is right here, 125 milligrams per 5 mils. Okay, I have my milligrams have to cancel out. So I put my 15 milligrams per my 1 kilogram. Okay, because every kilogram gets 15 milligrams. Okay, so then I have my 30 kilograms. And if I needed to convert, this is where I would do it. You multiply across, divide, 18 milliliters per day. Okay. Now, if I was doing it the desired over halved, I have to figure out what is the desired amount of milligrams per day. Okay. So for every kilogram, they get 15 milligrams. So I need to multiply. 15 times 30 is 450. 450 is now my desired milligrams per day. I have 125 milligrams per 5 mil clarithromycin. So I put my 450 on top, my 125 on bottom, multiply it by 5, and then it gets 18. This is per day. I know it said divided into 2 equal doses, but it wanted per day. All right, so now again, I have cephalexin 19 milligrams per kilogram by mouth, oral suspension every 8 hours. The child weighs 50 kilograms. How many milliliters are you going to administer to the kid? I'm going to give you 3 seconds. Pause if you need to. All right, so I have 250 per 5 ml in this bottle, okay? So once again, the question is asking for milliliters. So I put my milliliters on top. My 5 milliliters over 250 and my 19 milligrams per kilogram per day. I need to cross it. That means my milligrams cross out. I need to send them to cross out my kilograms. I know he's 50 kilograms. I cross those out, multiply across, divide by 250, and you get 19. Okay, so if I was doing the desired over halved, I have to figure out my milligrams per dose. So for every kilogram, they get 19 kilograms. Sorry, for every kilogram, they get 19 milligrams. So I need to multiply 19 by 50, and that gives me 950 milligrams per dose. So that's my new desired is 950 milligrams. I have 250 milligrams in 5 mils. So divide and multiply by 5, it's 19. All right, so now we're into safe dose ranges. So I have a patient who needs 100 milligrams of phenytoin oral suspension by mouth daily. The recommended daily dose is 4 to 8 milligrams per kilogram. The child weighs 30 kilograms. What is this a safe dose for this child? I'm going to give you 3 seconds. Pause if you need to. All right, so how do we figure out if this is a safe dose? So our recommended dose is 4 to 8 milligrams per kilogram per day. So for every kilogram, they get 4 or they get 8. So we start with our minimum first, or I always do. You can do either one first, it doesn't matter. So 4 milligrams per 30 kilograms. We got to multiply. That gives me 120 milligrams per day. So that goes on my minimum range. Okay. For my maximum, I take my 8 milligrams times my 30 kilograms, and I get 240. So that's my high number. So the safe dose for a child that weighs 30 kilograms is 120 to 240 milligrams per day. The child had an order for phenytoin 100 milligrams PO every day. Is 100 milligrams between the safe dose? No. So this is not a safe dose, okay? It is not an effective dose, so it is not safe, okay? So when you do have a safe dose range, you have to figure out what the minimum, then you have to figure out the maximum, and then that's where you look, okay? If for every kilogram, they need a specific number of milligrams, which is why we multiply. You could do this on your hand if you wanted to. So 4 times 4 plus 4 plus 4 plus 4 until you get to 30. But that's just multiplication, okay? The other important thing to remember is if you have a question like this on your test, this is how it's going to be written, okay? No spaces, dash, only a dash, and numbers. No dosing or anything like that either, okay? So if you see no space or dash only, use numbers only, use a dash, no space, this is what we're talking about, the 120 to 240, okay? All right, now I have doxycycline 100 milligrams IV piggyback daily to infuse 100 mils of D5W over an hour. The recommended dose, daily dose is 2.2 to 4.4 milligrams per kilogram per day. The kid weighs 45 kilograms. What's the safe dose? Is this an safe dose? Sorry. Once again, 3 seconds. Pause if you need to. All right, so we take our minimum, the 2.2. We multiply it by our 45 kilograms, and that's our 99. So that's our minimum. Then we take our 4.4, multiply it by our kilograms, and that gives us our maximum. So 99 to 198. The order was for 100 milligrams. Is 100 between the 99 and 198? Yes. So yes, this is a safe dose. All right, so now we're in a body surface area. There is a video on Canvas under web links, under your module. please, please watch it, okay? Hopefully it'll help and there's practice questions, okay? The most important formula you need to memorize is this bottom one, okay? We use body surface area when we need a very specific dose for a child. 1 kilograms in continent, we need even a better, more specific number. So like chemotherapy, things like that, okay? This 1.73 is the average adult BSA. If you hear me say BCA, I mean BSA. So that is why we divide by it. So we take to get the child's dose, we divide the child's BSA by the average adult BSA, and you multiply by the normal dose. It seems crazy because it's got all these square roots and exponents. It is super simple, okay? All right, so let's do the first one. The child's dose, what is the child's dose in milligrams? Their BSA is 10. The adult dose is 50 milligrams. So plug it into your formula. I'm going to give you 3 seconds. Super simple. 10 divided by 1.73 multiplied by 50 is 289. So it actually came out to a decimal point, but you usually round to the nearest tenths. The nearest tenth was at 0.0, so it's 289. Okay? Does that make sense? If it doesn't, there are practice questions online. Watch the video, okay? All right, so now we have a BSA of 5.4, an adult dose of 300 milligrams. What's the child's dose? All right, plug it in. 5.4 divided by 1.73 times 300, 936.4. That's it. The BSA looks confusing, but it's really not, okay? So practice, practice, practice. Take it seriously and practice, okay? If you need help, put it on the discussion board. Ask for help. Email me if you need to, okay? Watch the videos on Canvas. They will help, okay? Do the practice, everything like that. And that is all, and good luck.